About cystic fibrosis.
What is cystic fibrosis? Cystic fibrosis is a hereditary condition that affects the lungs and digestive system. The body produces concentrated and glutinous mucus that can blockade the lungs and restrict the pancreas. Cystic fibrosis, CF, can threaten your existence, and people with this disease are likely to have a short lifespan.
Symptoms. Normally, infants are born with cystic fibrosis, CF. Then they get diagnosed later in life. Some symptoms that help doctors identify CF are very salty tasting skin, continuous cough, sometimes with phlegm, incessant lung infections including bronchitis and pneumonia, wheezing or shortness of breath, male infertility, poor growth or weight gain even in good appetite, and frequent greasy, bulky stools or difficulty with bowel movements.
What happens in the body? Cystic fibrosis is a disease which mainly affects the lungs and the pancreas, but it can also affect other parts of the body that make mucus or other watery juices and secretions. The epithelial cells do not function properly in people with cystic fibrosis. This makes mucus and secretions thicker than normal. CF also causes certain parts of the body, such as the lungs, to clog up. This is caused by a gene which is abnormal called CFTR. CFTR controls the flow of water and salt in and out of the body cells, and this makes the mucus more thick and sticky.
Diagnosis. Doctors diagnose CF in many ways, the most popular of which include sweat tests, which measure salt levels in skin, see if patients have higher salt levels, genetic tests, which are used to find the cystic fibrosis gene, screening tests in which babies are pricked at their heel to draw blood to detect the CF chemical. There are other tests, but these are the most common.
Treatments. There is presently no antidote for cystic fibrosis, but a variety of medications are accessible to help curb the symptoms, avert complications, and make the ailment more comfortable to live with. Potential treatments consist of medicines to avoid and cure chest infections, antibiotics to make the mucus in the lungs thinner and easier to cough up, medicines to broaden the airways and decrease inflammation, certain techniques and devices to help eliminate the mucus from the lungs, medicines that help a person consume food better, practicing a special diet, and taking supplements to avoid malnutrition. If the lungs become greatly damaged, a lung transplant may be eventually needed.
Interesting facts about CF. The longest living person with cystic fibrosis is an Irish woman who is 76. There is a novel about CF by author Rachel Lippincott named 5 Feet Apart. About 30,000 people in the United States have cystic fibrosis. 25% of people with parents who are both carriers of the CF gene will have cystic fibrosis. People with CF cannot be near other people with CF because of cross-infections. Thank you for watching. Hope you learned about cystic fibrosis. Please subscribe to have your questions answered. Comment your questions down below and we will do our best to answer.